Insurance requirements. At the age, healthcare is priority when you retire. However, you will probably focus for more on healthcare than ever before staying healthy. Health is your goal, and this can mean more visit to the doctor for the preventive tests and routine checkup. There is also a chance that your health will be decline. You grow older, increasing your need for costly prescriptions, drugs, and or medical treatments. At any age, healthcare is priority when you're retired. However, you will probably focus more on healthcare than ever before. Staying health is your goal, and this can mean more visit to the doctor for prevent tests and routine checkup. There is also a chance that your health will decline as you grow older, increasing your need for costly prescriptions, drugs, or medical treatments. That's why having health insurance is extremely important. Retirement, your changing health insurance need. If you are 65 or older when you retire, your worries may lessen when it comes to paying for health care. You are most likely eligible for certain health benefits before Medicare, a federal health insurance program upon your 65th birthday. If you if you retire before 65 age, you'll need same way to pay for your health care until Medicare kicks in generous. Employers may offer extensive health insurance coverage to their retiring employees, but this is the exceptions rather than rule. If your employer doesn't extend health benefits to you, you may need to buy private health insurance, which may be costly. Extend your employer sponsored coverage through Cobra or purchase an individual health insurance policy through either a state based or federal health insurance exchange marketplace. But remember, Medicare won't pay for long term care. If you ever need it, you'll need to pay for that out of pocket or really on benefit from long term care insurance LTCI, or if your assist and or income are low enough to allow you qualify Medicaid. More about Medicare. As mentioned, most Americans automatically become entitled to Medicare when they are turned 65. In fact, if you are already receiving Social Security benefits, you won't even have to apply. You'll be automatically enrolled in Medicare. However, you will have to decide whether you need only a part of coverage, which is premier free for most retirees, or if you want to also purchase Part B coverage. Part A, commonly referred to as a hospital insurance portion of Medicare, can help to pay your home health care, hospice care, and inpatient hospital care. Part B helps cover other medical care such as physical care, laboratory tests, and physical therapy. You may also choose to enroll in a managed care plan and or prevent fee for service plan under Medicare Part C. Medical advantages. If you want to pay fewer out of pocket healthcare cost, if you don't already have an adequate prescription drugs coverage, you should also consider joining a Medicare prescription drugs plan offered in our area by a private company or insurer that has been approved by Medicare. Unfortunately, Medicare won't cover all of your health care expenses for some type of care. You'll have to satisfy a and make co-payments. That's why many retirees purchase a Medigap policy. However, it's illegal for an insurance policy company to sell you a Medigap policy that substantially duplicates any existing coverage you have, including Medicare coverage. You don't need and can't buy a Medigap policy if you are enrolled in a Medicare Advantage Part C plan, and you may not need it if you are covered by an employer sponsored health plan after you retired or you have coverage through your spouse. What is Medigap? Unless you can afford to pay for a thing that originally Medicare Part A and Part B doesn't cover, including the annual copayment and dedicated deductibles that apply to certain company type of care, you may want to buy some type of Medigap policies. When you sign up to Medicare Part B, there are 8 standardized plans available, including new to Medicare except in Minnesota and Wisconsin, which have their own standardized plan. Each of these policies offers certain basic care benefits, and all but the most basic policy, Plan A, offer various combinations of additional benefit designed to cover what Medicare does not. Although not all Medigap plans are available in every state, you should be able to find a plan that best meets your need or your budget. When you first enroll Medicare Part B at age 65 and older, you have 6 months Medigap open enrollment period. During that time, you have a right to buy the Medigap policy of your choice from the private insurance company, regardless of any health problem you may have. The company cannot refuse you a policy or charge you more than other open enrollment applications. Thinking about the future long-term care insurance and Medicaid. The possibility of prolonged stay in the nursing home weighs heavily on the mind of many older Americans and families. That's hardly surprising, especially